Good morning, everyone. Thanks for coming. I know there's so much going on this morning at the Senior Center. I'm glad you were able to make this choice to be here at the first session of our now annual Fall Prevention and Wellness Series. You are here to learn and continue to take charge of your health. It's my pleasure to introduce our keynote speaker, Dr. Maddie Castile, Commissioner of Health and Human Services for the City of Worcester since 2015. I'm grateful for her leadership and look forward to hearing what she has to say. Please welcome Dr. Castile.
So thank you all. I was telling Amy that if Joe Fish is next door, who's going to come to hear me? But I'm so glad you guys came to hear me. I wanted to talk to you a little bit about the things that I do. So actually, me? Okay. So I do a lot of stuff at the city, probably that maybe you haven't heard, but I do a lot of stuff with mental health. We're actually having an event today to talk about mental health in the immigrant community and LGBTQ community and what people experience and what people feel during that time. We have an opioid task force really looking at how we change what's happening in our community with overdoses. I'm sure all of you have heard that this is a huge public health crisis that we're having with people dying from overdoses. And that the drug is really a contaminated, it's not even what people used to think, that it was heroin. It's not, it's fentanyl. And then there's other things attached to it, like xylazine, which is like an elephant tranquilizer, which really can kill you. We talk about reentry, people coming out of jail, and how do we support people coming out of jail. We talk about affordability. Most of you have experienced gentrification in our city, that a lot of people cannot afford to get an apartment in our city, and so how do we help in that sense? We have a homeless outreach program that goes out and into the community and work with the people and try to get people into treatment. Certainly looking at policy changes, and I have to introduce Fran Anthes, who's behind us over there, who is the head of our Board of Health, and I think certainly has made an impact in our community with the things that some policy changes. And we talk about health equity, belonging. There's a group called The Hub, which is anybody that you know, anybody that the school system knows who has high risk factors that you're worried about, you bring it to the Hub, and there's other agencies there that can support the individual and make sure that that person is doing okay. And then we talk about youth violence. So one of our departments, the youth department, really now has the grants to do a lot of the work on youth violence, and you've seen the numbers of violence in our community increasing. And so really a lot of work for us to be able to figure out what we do. I'm sorry, So you can go to the next slide. As most of you know, I'm also here to learn from you. I want to know from you what you think is important and what we should be doing. And if you have any questions about anything I talk about, I want you to talk to me and tell us. This is supposed to be interactional, that we can talk to one another about what's going on. So one of the things that I work on a lot is substance use. And I think I did this during my career. I am a physician. I'm a primary care physician that's been practicing for 34 years, actually stopped practicing this past October. And certainly a lot of the work that I did was also on substance use, but I did a lot of work with elderly and certainly had clinics throughout the Worcester housing. One of the things that have happened is certainly we changed the words of how we use our words in a lot of ways. And part of that is that we're trying to change what happens with addiction and change the stigma of addiction. How many of you have somebody in your family who has a history of addiction? How many of you know somebody that has a history of addiction? So most of you know that this is a problem in our community. And so part of it is that we've forever said that addiction was the person's fault, that they did it to themselves. And if we really look at the data and the information behind it, is most people start using drugs at the age of 13. They start with alcohol and cigarettes. And why do you think a 13-year-old is using drugs? Tell me.
To escape from reality.
Exactly, to escape from reality and dealing with stress and anxiety. And why does a 13-year-old have those thoughts?
There's no parents.
There may not be any parents. There may be trauma that's happening in the house. All kinds of stuff that parents are usually the problem. Yes.
Peer pressure.
Peer pressure is also right. And so people are trying to fit in, and that's why they use drugs. And so what happens at 13, and mind you, it's 8, and it could be as high as 16, but the average age is 13, is exactly that. And so kids decide that they want to try alcohol, and what does alcohol do for you? Who has a little drink sometimes? What does alcohol do? It relaxes you. And so the problem is when you start at a younger age to use alcohol because it relaxes you, what happens later on? And when does a child's brain develop? So there's a part of the brain that you'll look here that all drugs act on the brain. And it starts changing how that part of your brain reacts. And so if we move on, so it acts on these parts of the brain. And you can see that there are the beginning part, the limbic system that's shown there. But all what you need to know is those are, how kids process emotions, how they process, social information. But what happens is all this stuff is okay, they're drinking, they're feeling better, but they're thinking about, spontaneity, what do we call, deliberately thinking, reasoning doesn't really start to happen till they're much older, till they're what age? What age do you think this starts to happen?
In their 20s.
Where in their 20s? Late 20s. It's 25 years old. And so their brain is changing, and this is the way that people become addicted. So they start early on. They start with something simple that they think it's simple, alcohol and cigarettes, and move on to marijuana. And is marijuana the same as what marijuana was when we were kids?
No.
What's different?
It's pure on the fentanyl.
Right. Well, there is fentanyl in marijuana, and it's much more potent than what it was. And kids, and then what else is in, what do we do with marijuana? Do we just smoke it? What other ways are there? We cook it, there are chocolate bars, there are muffins, there are candies that people can buy. And no, the kids can't buy it, but we know somebody else does the buying, or they're laying around somebody's house and they're trying this. And so kids are becoming addicted. So when we talk about addiction, we say that addiction is a disease process. It's a disease process because it changed the brain. And now your ability to, what's the word? The need for more drugs becomes part of your being, and you'll see why. And this is just a graph showing you where we were of drug overdose deaths that were in 1968, starting in 1968, and you can see what ended up happening. So initially it was heroin, and then it went all the way up to the synthetic opioids. Do we also have synthetic marijuana? Have you heard of that? Synthetic marijuana? No, they make it, and it's cheaper. And it's actually cheaper than cigarettes. So people buy synthetic marijuana, which is called K2. Have you heard of K2? K2 is what you'll see people smoking. It has an incredible effect on people, certainly changing their mental health position. And so K2 is something that's being sold out in the community. I think once upon a time, I probably shouldn't say these stories, but people actually have a lot of K2 around, and because it's cheaper, that's how they deal. And you can go to most places and try to and get K2 from anywhere that you probably go to. There are people selling K2 in the community. But when we talk about opiates, you'll see that the numbers of deaths in our community have increased, and that's the latest data. And for us, we had, when we talk about rates, so when we talk about per 100,000 people, or per 1,000 people, that our numbers, if you compare us with other cities in Massachusetts, had the highest mortality for last year. It was the highest mortality for 2022. And so 2022 ending in 2023. And so for us, we've tried to figure out different ways of how we're going to deal with that situation. But next slide. I think one of the things that I always want people to understand regarding addiction is to know what happens when you, what your cravings are. So I always talk about baseline level of dopamine. Dopamine is something that's secreted in your body. It makes you feel good. That's what we all crave for, is to feel good. We have a baseline, and it says there we have a baseline of 100. So we live in 100. When we're feeling really sick, that we can't get out of bed, our dopamine levels drop, and they could be as low as 30, and we feel awful, and we don't want to get out of bed. What happens when you eat food? Many of you have been, feeling tired, you're trying to do something. What do you eat when you're feeling tired? You drink coffee, okay, caffeine. What else do you do? Sweets. What do sweets do for you? They raise your dopamine level. They make you feel good. And then what happens after you eat sweets? Right. Like I could eat 1,000,000 of them, and I need it to stay up and to do work, and then I don't want it to let go because I want to still feel better for the times that I need to be working. And so I can eat bags of candy during that entire time. Not the thing that you want to do. So I'm also going to tell you, nutrition-wise, it's the worst thing that you can do. But it's why also people are addicted to food and addicted to sugars, is that we also need it to feel better. But we have to be able to control that. Just like others are controlling their substance use, we have to be able to do that also. And so you can see that each one of the, whether it's food that increases your dopamine level, sex increases your dopamine level, and you can see the rise of what it does to your dopamine level. So we can measure what food does to you and what sex does to you, but we have no idea, for those who have not used cocaine or meth or heroin, I don't have no idea what it would feel like in that sense. But if we're talking pleasure of food and then pleasure of methamphetamine, you can see how people want to get out of themselves in a sense and feel something else. And then what happens is that when you're addicted, like we were addicted to sugars, you use a drug and you can see where the normal baseline is. You take the candy, you get a high, and you come out of it. The more and more you do it, the more that you're addicted to sugars, and you get your high again, but then you crash much more. And when you crash much more, you don't go back to the baseline, you need it much quicker. So people talk about when somebody goes into the emergency room and they had an overdose, and they're being evaluated by the doctor, but guess what? They don't even stay there. Why do you think that happens? When people go to the emergency room, they were given Narcan, so they no longer have any drugs in their system because the Narcan was bound to it, so it gets it out of their system. What do you think they just get up and want to leave? What happens to them? What was that? They want another dose, just like we want another piece of candy, right? And so there are medications to be able to give people so that they don't have to do this. The problem is that we have to change the stigma. We have to be able to say that medications for addiction is a good thing to do. It gets people out of poison drug systems, and it helps. We give back people, if you're diabetic and you need insulin, we give you back your insulin. So we have medications that do the exact same thing, that does increase your dopamine secretion, which is Suboxone or buprenorphine. And most of you have probably heard of methadone. Methadone has been around for a long time, but it's been very stigmatized. And people who take these drugs, people don't want to treat them as somebody who's being sober. And the reality is that they are being sober, no different than somebody who's got diabetes and they're taking their medication. It's the exact same thing. And somebody who's a diabetic and all of a sudden had a box of donuts, we don't say to them, I don't want to see you anymore because you had a box of donuts as a physician. No, we talk to them and we tell them and help them through that process. And it's the same that happens with somebody with addiction, that we have to continuously reinforce the importance of staying on your medication. The language has changed, and the language changes so that we don't, when we say somebody is an addict, it's an insult. You're describing their character and saying that they're an addict. They're not. They're somebody who has substance use disorder. And so all we say, oh, that guy's an alcoholic. No, he's somebody with, an alcohol use disorder. And those are the words that we use. There's a lot of times when we talk about how do we test people who are taking drugs, we do urine drug screens. And you will even hear the patient saying, my urine was clean. There is nothing in medicine that we talk about somebody being clean or somebody being dirty. It's part of the stigma behind that process. And so changing the words of how we talk to people also makes them feel more comfortable. It means that you're interested in talking to them, and you don't have that stigma. But there's a lot more that we have to do, but that's part of breaking that stigma. And then, we say, what happened? So we have seen higher levels, and this is just older adults in substance use, and you can see what it was back in the 1920s and how substance use has grown in our senior population. And those numbers have increased in our community overall. We've seen a rise in seniors with certainly substance use, and we've seen them with mental health conditions that have actually created also for them to use substance use. So this is probably the year that we've seen the highest numbers of substance use in the elderly community. Go ahead. So we talked about why are adults, why does anybody use drugs? And we said it's for all of us to make us feel better. I don't drink, you can keep going. I don't drink, but once in a while my husband will give me some shot of something, and whatever I was worried about, whatever I was thinking about just goes away. And you feel, not only that, I can even sleep pretty good with that. And the reality is long-term alcohol doesn't let you do that, but we all do that. I have rheumatoid arthritis, so pain is a common thing with me, and so it goes away. I don't need to take anything when that happens. So pain, loneliness, all of these things, anxiety, depression, are things of why we may decide to use substances. But instead, what are the things that we can do to change that? And so what are the things that we could do for pain? And we talk about this a lot, and I think part of when we talk about pain is that us as physicians gave out medication to people to treat their pain. And we really need to, even when we think of an anti-inflammatory, they all have side effects. How do we curtail that? One of the things is really, do we change insurances to say they should be able to give us massages? Well, there's other methods that exist that can actually relax you, make you feel better, just like an anti-inflammatory or like an opiate. But how do we get insurances to pay? It's very easy just to say, I'm going to give you pain medicines and that's what's going to do, and then you don't hear from the person again. And then they're addicted to the pain medication. But really to think about what other things that we can do. Certainly going to the gym, certainly exercising, certainly stretching, all those kinds of things help. The fact that you're all here together is important. And I tell you, socialize, talk to one another, because those are things that make you feel good. I could have pain in the morning. People say, why do you go to work when you have pain? You know what? Being around people makes me forget about the pain. It didn't go anywhere. It's just that I forget about it because I'm busy talking or I'm busy doing something. And that's the importance of everything that you guys do here, is being together, sharing, talking changes all of that. There's no need for anything else because now you have a community of people. And that takes away the anxiety, the stress, all of that. So I don't know, what are stresses? What are anxieties? I think also making sure that, and I'm have the same issue sometimes as when we take medications, is that really looking at the bottle of medications, understanding what you're taking. I don't know, how many of you have taken too much of your medication sometimes? No, just me? Yeah, because I'm quickly trying to do something, and I open the wrong one, and I take the wrong one, and I took 5 pills of that one, and it was supposed to be 1 of that one. And as we get older, your system doesn't work in the same way. So the ability to actually have more toxic effects is important. So those are the kinds of things that we got to slow down. I tell myself that I got to slow down and figure that out because there are things that can cause more problems by the misuse of drugs. Go on. So these are just some data. We actually spoke about some of this yesterday, was to really talk about we've had an increase in overdose mortality with opiates, but what is bigger, what causes more deaths than fentanyl or xylazine? You know? What do you think causes more deaths? What drugs? Alcohol.
Alcohol affects every system of the body.
Exactly. Exactly. And alcohol starts to affect every system in the body in a slower process. And so you end up with, and I'll show you the next slide, you end up with liver disease. You end up, is that coming up? No, I went ahead of you. So these are all the things that can happen: poisoning, alcoholic liver disease, cancers attributed to, what's one of the main cancers that are associated with alcohol use? What do you think? Yep. Pancreatic. My father died of pancreatic cancer, and yet I never knew that he did alcohol, but he was certainly a partier when we had parties and loved to have his drinks. So I think about that now, but certainly pancreatic cancer, liver cirrhosis, suicide, absolutely, motor vehicle crashes, all of that, homicide. So these are all things that are part of consequences. And certainly these are numbers that increase in people going into the emergency room and all the complications associated with that. Have any of you been to the emergency room lately? And the other thing that they didn't expect is we're the baby boomers. Didn't we know we're the highest population, that we were coming? And did we plan ahead of time for all of us who were retiring? We didn't plan ahead of time. And so a combination of everything you said, a combination of COVID, and a combination of not increasing the amount of docs and not increasing the amount of nursing to deal with us, all of us retiring, didn't happen. Right? Right. So those are all things that are happening that we think about in our healthcare system, that how are we going to solve some of those issues, that we don't have enough beds. We are probably seeing more people in the emergency room than we were seeing during COVID, and certainly having a lot of issues in that sense. And then when we think about hospitals that are closing, what happened to Stewart? Right? So Stewart, how many hospitals throughout Massachusetts have been closing? We closed in Leominster, we closed maternity beds. We have some of the data that shows that maternity is, women of color in particular who are pregnant are having the worst outcome. And we're one of the worst in Massachusetts for that. But those are all issues that are happening in our community that we're not being able, because of our crisis in healthcare, that we are not treating things adequately. And so how do we change that is the process of what we're trying to do now. So back to alcohol, these are some of the things. Interestingly enough, what happened during COVID with alcohol? Increase of usage. But what did the government do to alcohol? What did they say to all retailers who had alcohol? They can stay open. Not only did they stay open, they delivered it. They delivered it to your home. Right? I mean, think about that, and think about why we have alcohol in our community. We did that. And so the belief was it the belief that we didn't want anybody to withdraw from alcohol? Did we want people to feel better? But that was the one thing that was open. I think it's been a culmination of what happened during COVID for all of us. And then I think it's in a sense what's happening to healthcare. I think what happened with Steward is they have private equity firms. So when hospitals aren't doing well, private equity firms come on in, they take over. but in reality they end up losing money. And most private equity firms who do this to hospitals fail. And then that's more people that we have in our hospitals, other hospitals in the area who have to pick up the slack for someone like Stewart, who had a private equity firm who tried to help them out. For us, what are we doing with our mental health issues that we need so much drugs to make us feel better? We're probably one of the most in the world who do this kind of stuff, that this is who we are. And that's, I keep saying, what are we going to do to keep our sanity, to not to feel lonely, to engage so that we're not separated, and we don't need any extra outside stuff to help us. And that's, I think that's an important piece, and that I hope that we change of who we are, in the sense that family is incredibly important, friends are incredibly important to help us be part of a society. And I think that's the part that we're losing, is that we're not there with society, and we need to be. I think we need to care for one another, and we don't do that anymore. And I say this with all due respect, but I also feel that, you know, we see homeless people and we see people who are suffering with addiction, and we say, I don't want to talk to them, I don't deal with them. And it's no different with mental health issues or anything else, that we have to be a part of society, and we have to care about not only us, but the people around us. And I think that would be a huge piece of changing our society. You know, we talk about homeless people, and that we don't know, nobody wants them in their backyard, right? The whole NIMBY that we hear about things like that. What happened to our society where we help one another and we help people and put them in housing and give them that extra support? We don't. And so we say, well, we need more housing. Yeah, but we're able to get you more housing, but nobody wants more housing. So there's a lot of policies and things that we need to change, but we as a society also need to change to be able to do some of this. Keep going, protective factor. One of the things I wanted to talk to you about, because I'm sure Amy's got my time and I'm over my time, whenever you get to overdose prevention centers, there's a lot of things that we could do to prevent a lot of this stuff, and a lot of it is based on community, is based on family, and about changing stigma about how we feel. I think overdose prevention centers, have most of you heard about this? And I'm talking to you guys because I want you to understand that if it comes up in discussions. Did you know what overdose prevention centers are? So that's treatment. That is actually that you go in and they'll give you prescription for medication so that you don't have to use fentanyl and any other drugs, that this will help you with that. Have you heard of safe consumption sites? So safe consumption sites are a place where somebody can go and somebody uses drugs in the presence of somebody who's monitoring them. They are in Europe. There is over 200 safe consumption sites. They're called here overdose prevention centers. There is 2 in New York. Rhode Island just opened one. And so there are staff trained to do that. They have nurses to do that. Most of the people who are coming in, or a lot of the people, are people who are suffering with mental health or suffering with addiction. Now, if we were to monitor people and make sure, because none of these places ever have had an overdose death. So if they don't have any overdose deaths, what is our responsibility as a community? Is it to prevent people from dying? I hope that is. And so our goal is to help people not die. And so we did things like syringe exchange. I'm sure when you heard about syringe exchange, AIDS Project Worcester does syringe exchange, that we're going to give you a clean syringe for you bring your dirty syringes, and I'm going to give you a clean syringe. Why did we do that? It was to prevent infections that happen. But what else happens in a place like that? Besides getting clean needles so they don't get hepatitis C, so they don't get hepatitis B, what else? Education. It brings people in contact with people who understand the situation and try to help people out. So they bring physicians who come there, they see them for all their issues, they engage with them, they provide housing. And these are people who probably would never come in, but they came in because, you know what, I don't want to get an infection, so I'm going to get a clean syringe. Or maybe I don't have the money to buy a syringe, but I'm going to give you the syringe. But it prevents people from using those. I know, it's a lot of stuff, but it's a lot of stuff that we have to keep doing to change. So the same thing as a safe consumption site. It is a place where people, they have 6 booths. I went to see them in New York. There are 6 booths, and people come in, they test their drugs. We find out that they have fentanyl or they have xylazine in there, and they may not want to change what they're doing, but the person who's taking care of them knows about that. Like sometimes when I want my donut, I don't care what's inside my donut. I'm hungry and I want to eat my donut. And it's okay. They know. We're telling them what's inside their drugs. But at the same time, we offer them treatment. We offer them food. We offer them a place to be. Because where are they now? Where are people who are homeless now and suffering with addiction? Under the bridge. Where else do they go? Vacant buildings. The library. They hang out at the library. They hang out everywhere. And people say, why are they hanging out everywhere? Because we don't give them a place to be. So let's give them a place to be. Let's give them a place where they can be treated, where they can have a place at least that somebody will relate to them and can hopefully get them to become sober, provide housing, and provide all the other things that they'll need to hopefully lead us a life.
Thank you.
Thank you.
You
I
have
tried.
such heart.
I
You
tried.
did great. Okay.
Good morning. I see maybe some familiar faces in the room from last year. My name's Cindy Beth Palmgren. I work.
Can't hear you.
Oh, sorry. Can you hear me now? Okay. Just tell me to speak up. I can speak very loudly. So, my name is Cindy Beth Palmgren. I'm one of the trauma nurse practitioners at UMass, and I've been doing that job for about 19 years now. So I come to you from work in my regular dress, because I started my day at 6 a.m., and I'm here to talk to you about aging gracefully. What I'd like to do is try to get through this lecture in approximately a half hour-ish, and so that brings us to about 11:15, and then I understand you're having lunch at 11:30, so I was hoping to have at least 15 minutes for questions. Can you guys still hear me back there?
Yes.
Okay, all right, great. All right, so let's get started. I'm going to quickly go through these slides. So this is what we're going to discuss. We're going to discuss the expected bodily changes. We're going to discuss how to age gracefully, and discuss what we can do to stay young and to prevent harm. All right, so this is just a picture of, what you look like as a young lady and what you look like as an older woman. All right, so what happens to the body as we age? Well, there's a lot of obvious things that happen. The number one thing on the list there, the wrinkled skin. Well, we obviously lose the elastin in our skin, and our skin does wrinkle. And some of us wrinkle worse than others. We have the graying hair. So what I want to just let you know is that many of these things are inevitable, and it's variable. So, there's not a lot of things we can do. It's genetic. It's just what we're made up of, and it's going to happen irregardless. But there are some things that we can do to protect our skin that I'm going to talk about a little later, to help keep you looking younger. And it's never too you're never too old to start. So from this day forward, hopefully I give you some tips, and you'll continue to look the same as you look for the next 20, 30, 40 years. So as we know, there's some people that are young 80-year-olds, and then there's some really old 40-year-olds. So again, it has to do a lot with genetics and with lifestyle, with how you take care of yourself as a young woman or man, and how you're going to actually age. So talking about skin integrity, in the skin or the integumentary system. So one of the things that I want to make sure that everyone takes home is that sun protection is very important. That ages your skin. It causes wrinkling, it causes roughening and mottling of the skin. The face and the neck even more. So it's important even in the wintertime to be applying lotions, to be putting something on your face and your neck, anything that's exposed to the sun, because you still are getting those UVA and those UVB rays that I'll talk about later. As I said again, genetics. You dark-skinned people in the room, you age less fast than white-skinned people because of the melanin that you have in your skin. So you tend to stay looking younger longer, where us white, very white people like myself age more quickly. We have elastin fibers in our skin that actually loosens over time, and that's when we get the saggy skin. So again, skin protection is like the number one thing that I just want to bring home to you guys today, that you need to protect your skin. You need to every day apply something to protect you from sun. So there's layers of the skin, and I'm not going to talk too much about this. Just quickly, I wanted to show you the different layers, the epidermis, the dermis, and the subcutaneous tissue, which is where the fat and the connective tissue lie. So skin becomes more fragile as we age. It becomes very thin. That top layer of skin goes through a lot of changes. And you will have the outermost layer of the skin is not replaced as quickly as when you're a young person. There are some things that we can do to remove that top layer that I'll be talking about and spend quite a bit of time on as we move along. You have fewer sebaceous glands. You remember when you were younger and you were a teenager and your skin was always so oily and you were trying to like always pat the oil or put a foundation or powder on to cover up the oil. Now you're in the opposite direction and you're trying to keep your skin hydrated and try to keep your skin moist. But that's just something that is going to happen to all of us. We're going to lose these sebaceous glands. Collagen, elastin, the connective tissue gets replaced with inelastic fibrous tissue. So it's not as elastic, it doesn't move as well. Your sweat glands diminish with age. And then the other thing is your vitamin D, you're not able to produce as much vitamin D as you age. So some of you, after talking to your primary care, I'm not going to promote any type of recommendations here. I'd like you to talk to your primary care before, but you want to consider vitamin D supplementation because especially here in the Northeast, we don't get the amount of sunlight that we need. So reversing wrinkles, this is what I think was really interesting when I spoke last year, and everybody had so many questions and wanted to hear what they could get so they could look younger. And the first one on the list there is the retin A, and that's a vitamin A derivative. That's something that you can actually buy over the counter. It's a retinoid. You can go to TJ Maxx where they have all the lotions and stuff, and you can pick up the retinoid vitamin A. The thing that I caution you with the retin A is that it's going to turn over your first layer of skin, so it allows for fresh skin to grow and for you to have a healthy glow, but it's also very irritating to the skin when you start it. So you don't want to start it and be using it every single day. You want to use it like 2 or 3 days, maybe during the week, maybe every other day, 3 times that week, and then you can slowly increase to a daily application of the cream. You want to keep it away from your eyes, keep it away from your nasal folds and your lips. And it actually does work wonders. It really can give you a much smoother complexion. There is prescription retin A that you can get from your primary care or a dermatologist, but generally in anybody that's of your age, the insurance is not going to pay for it because it's mostly given to treat other conditions like acne, and they're not going to give you a cream to make you look younger. So we have to buy it on our own. Dermabrasion is another thing that you can have done, and this is a pretty rough. It's a pretty rough procedure where they basically remove that top layer of skin, and you're very bright red for a long time. It's not indicated for dark tissue people or dark skinned people because it can actually cause like tattoos on the skin or cause scarring. It's only for light skinned people. The microdermabrasion, which is more like rubbing sandpaper on your skin, also removes that first layer of skin, is something that is for any type of skin type. So those are 2 other things, but these things cost money. It's not something that you can go to your doctor and say, I want to have done. It's anything on this slide is going to cost you money to be younger. So we have to think more about prevention and wearing our lotions and protecting ourselves from the sun to protect our skin. Collagen is something that you can take by mouth. There's different cocktails out there. I actually have one still in my cabinet that I haven't even tried yet, thinking that it might help with my aging. And it helps to just bring back some of the elastic in your skin and give you a better glow, and to reverse the signs of aging. And you can buy it for relatively inexpensive. I know I bought mine at TJ Maxx, and it was like $5.99 for a small little jar of it. And you just put it in a liquid and drink it. Botox is out there to help with wrinkles, basically freezes the area of the face. Botox also has medical conditions that we use for patients that have like torticollis, if they have like spasm in their neck, if they have trigger fingers, they use it for multiple medical issues. But in the plastic surgery world, we use it for basically to get rid of lines. It basically smooths out the skin. And it's sold in units, and it is very expensive. In some spas now, they open these spas that have Botox, and there's people that do this, and I caution you that have gone and taken a course. They're not really, they might be trained in just injections, but they don't have a lot of medical background. So you want to be careful who you go to get these services. You want to make sure it's somebody that's a licensed medical provider, plastic surgeon, or dermatologist. Or some nurse practitioners like myself do that as well. And then, of course, there's cosmetic surgery if you want to go that route. Facelifts, eye lifts, neck tightening, fat transfers are becoming a popular thing where they take some liposuction from your belly or any areas of your body, and then they inject it in places that you need a little bit more volume, because as you age, you tend to get sagging, you lose a lot of volume in your cheeks, in your temporal area, and they can actually take that fat and they can take it from you, and the same day they can put it into those areas of your face, and it really works well because it is your own body substance that we're putting back in there. So just some things to think about. So prevention, we talked about suntan lotion and the ozone layer, and UV is basically the UVA lights and the UVB lights. Most of the sunlight is UVA, about 95% that comes through the sun, and about 5% is the UVB. The UVB is the burn, gives you the burn. The UVA just gives you the nice glowing tan. But you really want to limit your time in the sun, and you really want to protect yourself because it can lead to other things like cancers of the skin. So very important to limit your time in the sun and protect yourself as well. All right, I was quickly going to talk about the musculoskeletal system. As you know, your bones get weaker as you get older. Men tend to lose a higher proportion of muscle mass than women do, especially over the age of 65. There's a decline of skeletal muscle. We have progressive loss of muscle mass and strength, if that's called sarcopenia, which is that first term on the list. Our basic metabolic rate, this is the amount of energy that our body burns at rest just for breathing, for our heart pumping, for digesting food. It's different for everybody, and it's a formula to actually figure that out, but that decreases. So, maybe when you were younger, you could take in more food and not gain weight, but as you get older, your basic metabolic rate slows down. So, you find that you're eating less and you gain more weight because you just don't need all of that energy because your body is slowing down. One of the things that you can do to help with the musculoskeletal system and protect yourself from injury is to develop a good posture. So that would be, you want to make sure that you stand straight. You want to stand hips apart with your legs. You want to make sure that your pelvis is in a neutral position, that it is centered. You want your knees to be a little bit bent. You don't want them tight. And you want to put your head back and your shoulders back. And you want to concentrate on keeping that type of of statue when you're standing. Of course, that's not possible for all of us, but we do want to make sure that we stand up straight, because having these habits of just slouching, over time, that's going to become the way your posture is going to be. So you want to make sure that you put your shoulders back and stand tall, and always make sure that your feet are hip length apart and your knees are bent when you're standing still. That'll give you a good base of support, and you won't fall over. Calcium and vitamin D is something that I would recommend all of you talking to your doctor about being on. Women over the age of 50 and men over the age of 70 should be taking 1,200 milligrams per day. In addition to that, you need the vitamin D, which you get from the sunlight. But remember what I said before, you don't get as much vitamin D as you get older. Your skin doesn't make it. So you need to take a vitamin D supplement. You need the vitamin D for the calcium to be absorbed. So it's important to have both on hand. And you can talk to your primary care doctor about what the recommendation is for how many milligrams of calcium they want you to be on and how many international units of vitamin D that you want to be on. Prevention of musculoskeletal injury is exercise. So no matter what exercise you do, anything is good rather than doing nothing. So walking, keeping your body active, always moving, not sitting around all day. Some people have different stamina than others, but you should be up and using your body, keeping your body in motion. That keeps your bones, it keeps your blood flowing, keeps your bones strong. So something that you should consider including in your daily activity. In the cardiovascular system, basically the main function of the cardiovascular system is to transport nutrients and waste from all the cells in the body. And this becomes less efficient as we age. Our heart is a very strong pump when we're younger, and then as we get older, it's just not as strong. There is ways to keep it strong, and that again is, I'll talk about the exercise again, is to keep your body moving, keep active. Changes with the cardiovascular system with aging, more difficult to sustain high levels of exercise over a long period of time. You just poop out fast. You can't get up and go for a 45-minute walk like you used to be able to when you were 10, 15 years younger. You just don't have the stamina. You need to take rest breaks. That's okay. I mean, it's better to walk a half hour than do no walking at all. Or if you can't walk a half hour, it's better to go out and walk 15 minutes, take a rest, and then later on in the day go out and walk 15 minutes. As long as you get your body moving. And I'll just say that the heart thickens and increases in weight with age. So it becomes stiffer, it becomes more calcified, and it's just not as efficient as it was when we were younger. The next system is the lymphatic system. So this is what basically filters all the waste out of your blood system. And there's two major functions. It actually collects excess fluid from around the cell and returns it to the bloodstream. And it is protective in that the lymph nodes throughout the body contain immune cells that help to filter out the bacteria and the viruses. The two organs that are responsible is the thymus and the spleen. The thymus actually shrivels up as you get older and doesn't really do a lot for you. The spleen, some of you may not have your spleen in here, you're just at more risk of bacterial infection and blood infections if you don't have a spleen. But you can live without the spleen because your other organs, such as your liver and your lymph nodes, will actually kick in and will do the same thing as what the spleen does for you. All right, I already talked about this, that elders are at higher risk for infectious disease, and antibodies produced do not respond as vigorously in an older person to the bugs, the antigens, that they do in a younger person. I'm going to skip over this and talk a little bit about the respiratory system. The respiratory system, basically, the main effect on aging is the amount of oxygen taken up by the blood, and also our vital capacity, or the amount of air that we're able to take in with breathing, decreases as we age. And that's really not something that we have a lot of control over. It's determined somewhat by, as you're a younger girl or guy, how you took care of yourself. And, you know, obviously smoking, your vital capacity is going to be less, and you might not have the same cardiovascular strength that you would of one of your counterparts if you were very athletic and you moved a lot when you were younger. I do just want to say that the respiratory system, one of the big things that happens with age is that we have a decrease in cough. And if you think about what cough does, cough actually expels anything that you've taken in through breathing that you don't want to take into your lungs. So that's what cough is. You're exposed to some toxin or something in the environment that will make you cough. You're expectorating it, you're coughing it out so that you don't breathe it back in. And that does decrease with age. And there's not a lot that we can do for that. Very important to have a regular exercise program. Very important to, as we heard from our speaker this morning, limit your alcohol and drugs. Smoking is very bad, as we know. It causes lots of disease. But alcohol and drugs also they're very prevalent out there and have become more prevalent and can lead to premature aging and to death. Digestive system. So as we age, the digestive system isn't able to break down nutrients and absorb them into the bloodstream as when you were a younger person. So it's oftentimes very difficult to digest some foods that you might have been able to tolerate as a young person. Some people just can't handle like salads or red meat as they get older because it does take a lot when your food goes through the digestive system to break down, and they're very complex proteins and carbohydrates that you can't actually break down as you age. So some of the things that you don't reabsorb in your digestive system when you age is you don't absorb some of the important vitamins. We talked about calcium. So calcium is something that you generally have to supplement. The B vitamins, B1 and vitamin B12, those two vitamins you don't absorb very well as you age. It's not problematic if you're eating a healthy diet, though. You don't have to take vitamins. Not everybody should take vitamins. You should talk to your primary care physician first, but if you are having a very well proportioned diet and you're getting all the food groups, then you may not need the vitamins. But one of the things that we often test in older people is their vitamin D level and their B12 level, because that can lead to cognitive issues later in life. And then I just wanted to talk about teeth. I think more and more people are actually able to keep their teeth, which is very important to mastication, to chewing, to being able to digest that food. Most of their teeth, since the 1950s, the majority of people didn't have their teeth. And since the 1950s, that actually has gotten a lot better. And they're trying to save teeth now. They don't just pull them out. They try to cap them or put a crown on or put an implant in so that you don't have dentures, because dentures, as you lose weight, they don't fit well, and bottoms never fit well, and you can't chew as well, and and you get sores in your mouth. So there's a lot of education out there that take good care of your teeth. It's shown that higher education levels, those those people tend to take better care of their teeth, and that's because they can afford to go to a dentist. They can afford to buy the vitamin fluoride toothpaste that are very expensive. So teeth wear down over a lifetime, but it's not that significant, and if we all take good care of our teeth, we can keep them till we pass away. The urinary system, I'm just going to skip over that, but I wanted to say that muscles in our bladder wall weaken as we age, so we have a more difficult time holding urine, and the volume that we can hold of urine, and it goes for men and women, is less. So it's important that if you do have issues with incontinence, holding your urine, you should talk to your primary care provider, because it's not normal, and there's a lot of things that you can do out there, including exercises and medications that can help that. So incontinence is not normal. You do get weaker muscles, and there's a way to work with that with what we do, the Kegel exercises that you've probably heard. But you do, eventually, most people do have some issues with holding their urine. And again, I just would ask you to speak to your primary care physician. It's somewhat embarrassing for some people, but it happens to everybody, and it's better to talk about it and be more comfortable and be more confident going out in public when you can control your bladder and not looking for a bathroom all the time. All right, I have about 5 more minutes, so I'm going to skip ahead here. Okay, so these things I think are important to just mention, that what things influence memory and processing speed. So poor health, obviously lung disease, cardiovascular disease. Highly educated individuals show better cognitive status in their later years. Higher education promotes good health, and people that are really focused on thehave health and keeping their mind active tend to have less cognitive decline and memory problems. We have issues of sleeping as we get older. So if you do have issues with sleeping, talk to your doctor about that. Everybody needs sleep to recover. And if you're not getting enough sleep, your body's not going to be able to turn over, and you're not going to feel good and feel like you can do the things that you need to do to keep yourself healthy. So I would encourage all of you to talk to your primary care about what you can do to induce a really good night's sleep. You know these things, the sensory system, obviously our vision changes, we have hearing issues, taste and smell are different as we age, our balance and equilibrium are off, which causes falls, and then our somatic receptors, which are the cell endings located in the muscles, change, so things don't feel the same. I'm going to skip over that. What I do want to say about the age changes to the genital system is that women, obviously there is thinning of the pubic hair, and the vaginal walls are less elastic as you age due to the hormones and not producing them. But women are still able to enjoy a sexual encounter and are able to have an orgasm. Men, they tend to, up until they pass away, are able to have an erection, but it usually takes a little bit longer. And most men, by the age of 40, start having problems with their prostate. And most 80-year-olds have prostate issues. So don't feel alone in that. So I just liked the saying, aging gracefully. So ultimate limits to human lifespan are probably fixed. The onset of illness can be delayed so as to compress the lifetime experience of morbidity and the shortest possible period. Just thought that was a nice saying from James Fries. So we talked about prevention, women live longer than men. There's no single causative factor that predicts successful aging. A lot of things are out of our control, like the genetics that I mentioned. But these are some of the things that you can do to stay young. Meditation. Think as if you're a 20-year-old. You got to try new things. Stay active. I talked about getting some exercise. And we talked about sleep. And then I'm not moving. Adopt a plant-based diet, so limiting your red meats. Drink beauty and go skin revive, so drink your collagen and put your retin-A cream on. Raise your metabolism, raise your metabolism, don't skip breakfast. Green tea and coffee, keep moving, water, smart snacking. And that is it.
Hi, you skipped over something on the lymph system. Could you explain it? Is there stuff that happens with elder?
With the lymph system? I did just discuss a little bit about the two organs that are part of the lymph system, and that's the thymus and also the spleen. And both of those organs filter the blood. But as you get older, your thymus gland actually becomes a fatty tissue. The liver takes over at doing that filtration that the blood needs to get rid of all the waste. Spleens, people that don't have spleens and, for whatever reason, either because of injury or because of rupture or disease, the liver will take over for the spleen. But it is important that if you don't have a spleen, there's certain injections, there's 4 type of injections that you need to get from your doctor to protect you against like H flu, pneumococcal pneumonia, meningitis are basically the 3 things. So just something to keep in mind, those of you who don't have a spleen. I guess that'll do it. Thanks for your attention.